As with other vaccines, people who receive the COVID-19 vaccine may experience injection site pain and swelling, fever, headache, fatigue, and body aches. These mild symptoms generally resolve within a few days. Among those who received the vaccine, there were 4 reported cases of anaphylaxis, which is the rapid onset of severe allergic reactions. The individuals in their 20s and 30s developed multiple symptoms such as rash, breathlessness, lip swelling, throat tightness, and giddiness. 3 of the individuals had a history of allergies, including allergic rhinitis and food allergy such as to shellfish, but none had a history of anaphylaxis, which would have precluded them from receiving the vaccine in the first place. Anaphylaxis can be controlled when detected and treated in a timely manner. As all vaccinated persons in Singapore are closely monitored, the symptoms in these 4 individuals were promptly detected and treated. All have recovered from the episode. 1 was under observation for a few hours, while the others were discharged from the hospital after a day's observation or treatment. None needed ICU support. The incidence rate of anaphylaxis locally is about 2.6 per 100,000 doses administered. The incidence rates reported abroad is around 1 to 2 per 100,000 doses administered, after these other countries have administered millions of vaccine doses. Variations in the incidence rate are to be expected initially when the numbers vaccinated in Singapore to date are relatively small as compared to other countries. Currently, the benefits of getting vaccinated to protect oneself from the effects of severe COVID-19 disease and its complications far outweigh the risk of any potential adverse events known to be associated with vaccination. The Ministry, the Health Sciences Authority, and the Expert Committee on COVID-19 Vaccination have been monitoring international reports on vaccine-related adverse events and deaths in elderly recipients. The Norwegian health authorities and the World Health Organization's Global Advisory Committee on Vaccine Safety have found no evidence that the Pfizer-BioNTech vaccine contributes to an increased risk of death in the elderly. Thus, we continue to offer COVID-19 vaccination for our seniors. It's important, it's vital to vaccinate and protect seniors, as COVID-19 infection in the elderly has been observed to result in severe or fatal illness. Nevertheless, the Ministry has reiterated to vaccination providers that doctors should review the medical history of seniors carefully to confirm if they are indeed suitable for vaccination, and that they should be monitored closely in the immediate period after a vaccination. When a member of the public attends a vaccination center, the polyclinic, the PHPCs, the screening process includes a healthcare professional going through your medical history as well as the medication that you've received. And if that member of public has any queries or uncertainties, please let us know. And the staff will have access to the information through the National Electronic Health Records and will be able to pull up what they need to. And ultimately, if they are still not sure, there's a need to cancel the vaccination at all. You merely can defer the appointment until perhaps a fuller consultation with a healthcare professional who understands the situation of that senior and can make a recommendation. We completely understand the anxiety of Singaporeans who wish to travel overseas for personal reasons or who would like to get vaccinated early. At this point, when vaccine supplies are limited, we do need to prioritize our healthcare and frontline workers and seniors for vaccination. We are therefore unable to provide vaccines at this time to Singaporeans outside of these groups and seek their understanding. When there is greater certainty in our vaccine supply, we will consider allowing these individuals to receive early vaccination.